Welcome and namaste. Today we are talking about something which is very important and affects millions of families, but which is not talked openly. We are talking about alcoholic liver disease. Today we have a guest with us, Dr. K. Somasekhar Rao, Senior Consultant Gastroenterologist and Hepatologist from Yashoda Hospitals, Hyderabad. Welcome, doctor. Thank you. All of us know that alcohol can cause liver damage. What are the incidence of alcoholic liver disease in India, doctor? So, recent study says that around 5% of alcoholic liver disease is prevalent in India, and it varies from region to region. But most important thing here is around 8% of males are under alcoholic liver disease category, and in females it is little lesser than 1%. And in the last few decades, at least last 2 decades, the incidence of alcoholic liver disease has been increasing in India because of the pattern of drinking in youngsters. So this is all what we need to be aware of about alcoholic liver disease. What are the effects of alcohol on our body? What does it cause to our body? So alcohol has multiple effects on our body, and it affects multiple organs in the body. You start from the brain. It causes damage to a vital part in the brain called cerebellum. This cerebellum helps in balancing your body. So it affects the cerebellum. It affects multiple nerves in your body. So when the nerves are affected, you have pins and needles in your tips of your finger, all those things, paresthesias and all those things. And it can cause problem to your heart, causing alcoholic cardiomyopathy, where there can be heart failure. And all of us know it affects the liver. It causes cirrhosis of liver. It can also cause liver cancer. The other vital organ in the body called pancreas. This alcohol, when someone is binging on alcohol, it can cause acute severe pancreatitis. And acute severe pancreatitis can be a life-threatening condition. So it can cause damage to your gastrointestinal system. It can cause diarrhea. It can cause gastritis. Multiple effects in multiple parts of the body, and it also causes life-threatening complications in the body. We often hear people say 1 or 2 drinks doesn't hurt. Is it really true, doctor? Absolutely not. I'll tell you one thing. See, if at all 1 or 2 drinks in a week, that is okay, and 1 or 2 drinks in a day is definitely not okay. So whenever someone is taking this amount, fixed amount of alcohol, 1 or 2 drinks in a day, the absolute alcohol in the drink what you are taking definitely matters. And if someone is taking around 40 grams of alcohol or more in a week regularly, and if this continues for a prolonged period of time, that means more than 5 years, there is definite chance of damage to the liver. So alcoholic liver disease is a spectrum of disorder. So definitely these people are prone to get fatty liver because of alcohol, and some of them, if their genes are bad, they can go into something called advanced disease called fibrosis or cirrhosis of liver. So regular alcohol intake is not good. Ideally, no alcohol is good alcohol. What is considered too much alcohol? See, most importantly, everybody should understand regular intake of any amount of alcohol is too much alcohol. But when we are talking about youngsters and this generation, we need to talk about something called binge drinking, and we need to know what is too much alcohol. If someone is taking alcohol of 10 grams of absolute alcohol in an hour, that is more than that is too much alcohol. If in one evening, if someone is taking more than 2 standard drinks of alcohol, that means 20 grams of absolute alcohol, more than that is too much alcohol. And in a day, if someone is taking more than 3 drinks or 30 grams of absolute alcohol, this is too much alcohol. So to simply remember this, rule of 1, 2 and 3, please remember this, and anything more than this is too much alcohol. What exactly happens inside the liver when someone drinks alcohol regularly? See, basically, when we are talking about alcoholic liver disease, as I told, it is a spectrum of liver diseases. So, anybody who is taking alcohol regularly, if you take 100 people, 90% of them will have something called fatty liver, and this fatty liver is related to alcohol related fatty liver disease. So, initial stages, it is fatty liver, and then over a period of time, if they continue taking alcohol like this, there is a stage where the liver grows into stiffness. So the liver disease is a very slowly progressive disorder. So initially, once the fatty liver, over a period of time, it goes into a stage called fibrosis. The stiffness in the liver is increasing, and if left untreated or if not giving up alcohol, this leads to something called cirrhosis of liver. Cirrhosis is considered as an end stage liver disease where the liver becomes stiff and the 600 functions which normally liver does are gone down. So without these functions, your life is difficult to prolong. So cirrhosis is an end stage liver disease, and some people after cirrhosis can progress to liver cancer also. So fatty liver, fibrosis, cirrhosis and liver cancer. These are all the problems which can happen to your liver because of alcohol. Why are we seeing lot of younger people developing liver diseases in India today, doctor? Yeah, we are seeing lot of young people today around the age of 20 to 30 years presenting to us with liver diseases. Previously, we used to see people more than 40 or sometimes more than 50 only presenting to us with liver diseases. But these days, because of the pattern of drinking and the type of food which they combine while drinking, all these things are making an impact on the liver very faster. So a combination of non-alcoholic fatty liver disease and alcoholic fatty liver disease, non-alcoholic liver disease and a combination of alcoholic liver disease, we are seeing in younger people, and people are presenting to us with liver diseases like fibrosis or cirrhosis also in the ages of 20 to 30 years. So that is the reason why we are seeing more number of liver diseases in younger people today in India. So the type of food should be changed and the pattern of drinking should be changed to avoid these early liver diseases. Does alcohol affect men and women differently, doctor? Definitely yes. Women are more affected with alcohol than men. So the same amount of alcohol, if men and women take equally, uh, the woman will be affected because of alcohol, and her liver damages faster in half the time than the men. So alcohol affects both men and women, but the amount of alcohol which causes damage to females is lesser amount of alcohol because of multiple hormonal effects in females. So alcohol definitely damages more in females than men. Many people say and think, if I eat healthy, exercise regularly and drink occasionally, it is okay for my liver. Is that true, doctor? Unfortunately not. It is not true. See, simple. Definitely, people who are exercising and eating healthy food, definitely they are better off when compared to people who are not doing that. But that doesn't mean it will cancel the effect of alcohol on your liver. So, if you are on fire and plant trees around it, it's not going to nullify the things. Absolute abstinence from alcohol is the best thing to do. Eating healthy and exercising regularly are definitely good, but that doesn't cancel the effect of alcohol. If someone has developed alcohol related liver disease already, is there a hope for them? Definitely yes. See, most of the time alcoholic liver disease, as I talked, it's a spectrum, and if you identify someone in alcoholic liver disease in fatty liver stage, most of the time it is completely reversible, and only treatment is quitting alcohol. And sometimes you may find people in stage of fibrosis. Even when we find out patients in fibrosis stage, if they quit alcohol at that point of time and some medications, you will be able to reverse fibrosis completely and bring them back to normal. In advanced stages, in early cirrhosis, if you find people, you may not be able to reverse the disease, but definitely you can keep them stable at that point of time and allow it not to progress further. So definitely there is hope. At any point of time you can control the liver disease because of alcohol, and in some cases you can bring them back to normal. What are the early warning signs of alcohol related liver disease, and do we have any early test to detect them? See, most importantly, everybody should understand that is alcoholic liver disease, in fact any liver disease which is progressing, unfortunately is called a silent killer. Most of the time in early stages you won't have any symptoms, but if someone is very vigilant, they can understand subtle signs There will be tiredness, excessive tiredness, and loss of appetite. Some people can complain of nausea and generalized weakness. These are subtle signs. Most of the time, people ignore them. They will not attribute that to alcohol or liver disease. They attribute to some other things. If someone is very vigilant, we will be able to identify. Only liver diseases, when they are advanced, they present with symptoms of blood vomiting or swelling in the abdomen and all. But by the time you have those symptoms, your liver is already gone. So most important thing is being very vigilant about these symptoms. And the next question you are asking, yes, definitely we will be able to identify early stages. Regularly, if you are doing a test called liver function test, which is a blood test, you will see some problems in that liver function test where you can identify early stage of liver diseases. There is a test called Fibroscan where you will be able to identify the amount of fat on the liver and sometimes the stiffness, if there is early stiffness developing in the liver. So Fibroscan and liver function test, if you combine and do it once in 6 months, very early stages of liver disease can be identified. I heard something called problematic drinking. What does that mean, doctor? And what are the signs of problematic drinking? See, when someone is using alcohol, when they know it is negatively impacting their health and their life, this is definitely problematic drinking. These people are not dependent on alcohol or their body is not craving for alcohol. Only thing is, even if they know they are impacting their health and life, still they are drinking. This is called problematic drinking. And most important signs they need to understand is more than one time or more than many times whenever they drink they feel guilty and ashamed of drinking. They'll be drinking to they will be drinking just because they want to overcome stress and all those things. These people are not addicted to alcohol, but this is defined as problematic drinking. This is a danger pattern of drinking which everybody should understand. So this is very very important to understand because these people are easily able to quit alcohol just with good amount of motivation. And if they understand this is the problem, it is very easy to quit alcohol in these people. Is there any role for the family to play when someone is trying to quit alcohol? Is this really important? The most important thing, family support plays a very very important role. The alcohol addiction is not just a health problem, it is a social and emotional well-being is very very important. So people may require a lot of encouragement, they need to be supported properly and most importantly by the family, and they may require de-addiction treatments also. During this phase, most important thing is family being there with them without blaming them, encouraging them to quit alcohol. This plays a very very important role in de-addiction and quitting alcohol, and this will help in people who are actually trying to quit alcohol. This plays a very very important role. Family means a lot. What is the success rate of alcohol de-addiction in your practice, doctor? And what are the factors for failure of this? So most importantly, as a hepatologist, when people come to me, they already come to me with a history of liver disease. So when I counsel them properly, motivate them, 60% of them definitely quit alcohol and they will never go back to it. And 40% whom I say failure, most probably it is all because they don't have self motivation and lack of support from the family and community. So people keep blaming them continuously. If that support is not there from the family and community, those are the reasons for failure, is what I feel actually. I would like to ask you about one golden message you want to give to the public who are watching this episode about liver and liver diseases, doctor. See, first and foremost thing what I want to say everybody is be aware of liver diseases. Every one of us know about heart problems. Every one of us know about diabetes, hypertension, but lot of lack of awareness about liver diseases is there. Please know about liver and liver diseases. Most important. Love your liver and live longer. So for this, what I suggest is every year, please get your liver function test. It's a blood test. and an ultrasound abdomen to screen your liver. There are two viruses called hepatitis B and hepatitis C which can cause liver diseases. Alcohol, all of us know, a regular amount of regular alcohol intake or excessive alcohol intake can cause liver damage. Please avoid it. And now we are seeing something called non-alcoholic fatty liver disease. It's because of lack of exercise and the type of food what we are eating. Avoid them, stay healthy and keep your liver fit. Thank you. Thank you very much, doctor. And I think everybody of us should understand this, taking care of your liver. And thank you very much, doctor, for giving valuable information about liver diseases, alcoholic liver diseases, and how to keep your liver protected. Thank you very much.